Thanks everyone so far who's been joining. We're going to get started in about a minute to let people have enough time to kind of join us. So welcome everyone. All right. So thanks so much everybody for joining this webinar today that's co-hosted by Healthy Careers and locumtenens.com. I'm Christine Burke, a Healthy Careers Marketing Director who works to connect healthcare recruiters with best practices resources to find and retain healthcare talent. Today, we are so thrilled to have Dr. Maisha Esco, the Chief Medical Resource Advisor for locumtenens.com and vascular surgeon with us. Our goal today is to share what physicians are looking for and how to retain staff in the gig economy. The healthcare industry is facing a significant call to action as it confronts the emergence of the gig economy. The current landscape presents a unique situation. The global pandemic has shed light on the industry's vulnerability to burnout, prompting concerns about losing more physicians through early retirement or to career transitions. To address these challenges and safeguard the future of healthcare professionals, the industry must consider forward-thinking staffing models that evolve alongside the needs of patients and the demands of clinicians. So before we get into this great content, we have a few housekeeping items. If you could move to the next slide, please. This session is being recorded and will be emailed to you afterwards. We encourage you to ask questions using the Q&A button that you'll find on the bottom of the console. We have about 15 minutes carved out at the end of the session dedicated to Q&A, and any questions we aren't able to answer live, we will make sure to follow up directly with you. And there will be 3 polls asked during the webinar. To participate, you'll just select an answer when the poll pops up. Finally, we are excited to share that attendees can earn 1 continuing education credit from the Association for Advancing Physician and Provider Recruitment, AAPPR, and details on how to do this will be emailed to you along with the recording and presentation. Now to introduce Dr. Maisha Esco. She is the Chief Medical Resource Advisor for locumtenens.com and a vascular surgeon focused on full-time locum tenens work and licensed in 15 states. You could go to the next slide. She was recently named the 2023 National Staffing Employee of the Year by the American Staffing Association. For the past several years, she has served as a consultative member on the locumtenens.com Customer Advisory Board and now serves as the company's Chief Medical Resource Officer. And she is also a certified yoga teacher, world traveler, and mountaineer. Thank you so much for joining us today, Dr. Esco.
Thank you. Thank you, Christine, and thank you everyone for joining. I hope you enjoy this brief webinar where we try and tackle some issues and look at strategies to overcome some challenges. So a few learning objectives for today, as Christine previously stated, we'd like to look at today's clinicians, including shortages, burnout, and the economy. We really want to look at some perspectives of the physicians and advanced practitioners and what they're looking for from an employed and contingent basis. Lastly, we're going to give you a few strategies that's going to help you evolve with the gig economy and position your practice for success. So, as we all know, during the pandemic, everything changed for everyone in every possible way, especially how we work. Many of us were at home and had to alter how we did everything. Then the upraising of the gig economy occurred, where people were either working from home or getting other opportunities. But we also found that there were significant labor shortages, and we really needed healthcare workers. So the definition of work has evolved profoundly. So we really need to take a step back and look at the needs of healthcare providers in that arena, especially with the imminent labor crisis occurring. So let's just take a look at the job hunting in 2023. In fact, last year, November 2022, 4.2 million Americans actually left their jobs. It's a great resignation. But that really hasn't recovered. Just in 2023, this year, 96% of workers are looking for a new position. So a lot is really changing. There's a shift in how we work. So if we take a step back and look at medicine in particular, we've spoken about how the pandemic, a lot of people kind of reevaluated how they were working and where. But back in 2019, this study by the AAMC projected that by 2034, there would be a huge physician shortage, almost 100,000 positions short by 2034. That's pretty significant. What's even more startling is that the physicians who are eligible to retire in 2026 is also increasing. We have a huge number of baby boomers and clinicians who are deciding to retire. And in fact, 21% of primary care physicians will retire by, or at least eligible by 2026. So what happens? We have a huge shortage in clinicians where, on top of a pandemic, makes the workforce even more strained. So let's take a look at the growth of the gig economy. Now, when we talk about the gig economy, that's across all fields. So you may think of the person who decides to drive Uber or deliver food delivery services. The gig economy as a whole is growing 3 times faster than the workforce itself. It's generated $1.3 trillion in revenue. And it's estimated that half of the US workforce will be doing some type of freelance work by 2027. So why? We also, other than the pandemic, there are a number of reasons. One is just to earn more income, have more freedom and flexibility with work-life balance. And the other is to have that security, to have a portfolio of more than one client is more reliable than one employer. So what about with overall? It's not just gig workers versus full-time or permanent employees, it's a spectrum. So I kind of look at this as the 40-40 rule. So 40% of the US workforce will make 40% of their income doing gig work. That's a huge shift from the times when clinicians or even, regular workers would stay one place for 30 or 40 years, and that was 100% of their income. That's significantly changed, and it will continue along that trajectory. So what about in healthcare? Healthcare is actually seeing what's happening in the rest of the world and other healthcare and other work sectors, and it's catching up with the gig economy. So the future of work is taking a new shape, just like everything else. So what does this actually mean for the healthcare shortage? The slide I just showed you, we were able to identify that there's a projected physician shortage that's going to be at critical range by 2034. We learned during the pandemic that shortage is already quite prevalent, and it's causing significant issues in our healthcare system. So what are we seeing with this shortage? A number of clinicians are significantly burned out, but that also includes, our support staff, admin, staffing agencies. Everyone's a bit burned out. There's a desire for flexibility, that work-life balance, the ability to work with more than one client or entity. And then finally, new career paths. Particularly for medicine, we found that a number of clinicians have elected to do locum tenens medicine as a way of practicing. So what I'd like to do is just go over some strategies of how you can adapt to this new normal, kind of, looking at the gig economy with physician shortages and strains and burnout. How can you actually adjust and be successful? So I'll go over how to understand your clinicians and staff, how to invest in your workforce, how to consider flexible staffing solutions, leveraging technology, embracing the gig mentality, and actually implementing a future-proof staffing model. So let's go. So look at understanding your clinicians. This is a tough one. I'm a clinician and I'm not sure that I understand other clinicians either, but there's strategies to do so and to do your best. This is a survey that was done at locumtenants.com where we looked at the future of work and kind of redefining that role in the physicians in the gig economy. And what this basically breaks down to is about 40% of all clinicians who are able to practice medicine, 40% under 50 are not. That's pretty startling. Remember the statistic I showed you that a number of up to 21% of primary care physicians will be eligible to retire in just a few short years. So if 40% of younger clinicians aren't even practicing medicine, that leaves a huge gap in our ability to care for our patients just because of volume and numbers. So we really need to take a look at why clinicians aren't practicing medicine. What happened or what are their concerns? So the reasons why some clinicians are leaving patient care are numerous, but the top reasons are burnout or moral injury, which we'll talk about, COVID and everything that surrounded that, whether it was changes in the medical facilities or environments they were working in or reevaluation of life, the retirement issue, leaving medicine or just choosing another career. And actually 12% had decided to actually leave medicine as a whole. So when we look at this and you're trying to understand your clinician, it's important to say, okay, we have a smaller segment of clinicians that are practicing, and what kind of things can we do, as an industry to help alleviate some of these reasons of why they're leaving? So what do physicians want? Why are physicians unhappy, or what are the number one and two kind of dissatisfiers for the physician? So just like gig workers and other sectors of business, physicians really want flexibility. They want autonomy. They want to be compensated fairly. They also want to be without significant administrative burden or issues. Another thing is scheduling. Sometimes clinicians are heavily scheduled and it's quite challenging. Again, the staff shortages and just the work and patient loads can be overwhelming. So I wanted to talk a little bit about moral injury. We've often heard the term burnout, and we're well versed on that, but moral injury is a little bit more in depth. Moral injury kind of goes against what a physician believes, it's going against their value system or kind of that Hippocratic oath that was taken. And it becomes really challenging, emotionally, and being able to, follow through when you have so many pressures. It's really about some of the demands that are placed on the clinician from the outside, either from industry or administrative burdens or scheduling burdens or other financial issues that may cause them to feel, morally injured. So this can cause subsequent fatigue. So after significant burnout and mounting moral injury, it just creates this chronic fatigue of practicing. So this is from the same study that we did, and almost 80% of clinicians reported that they had some level of burnout. 17% said they were completely burned out. So that's almost 90% have some level of burnout, either mild or significant. That's pretty startling. And there are ways that we can try and alleviate that. So physicians are pretty resourceful, and they really love medicine. And this is something really important to take a look at. 61% were likely to look for a new job. And that's the key, a new job, not necessarily a new career. You still want to stay in medicine, but there has to be a different way of practicing. Almost 60% said they were likely to work locum. So what does that say? That there's a different way to practice medicine that would provide flexibility, autonomy, and the ability to maneuver through their careers in a way that's more comfortable. So what about?
Oh, yeah. We're going to jump into the first poll.
Yeah.
So let me go ahead and launch that. And we're going to find the answer to this in the next slides. You should see a poll on your screen right now that says, what do you think the average turnover rate is for hospitals in the past 5 years? So I'll give a few, maybe 30 seconds for people to respond. A lot of people are guessing 26 to 50% so far. Let's get your answers in, and then we will continue. All right, so here's what the audience says. Our recruiters, 18% are guessing 0 to 25%. 26 to 50% had the majority of responses, and then 14% guessed 51 to 75%. And I know you're going to cover what this is in this upcoming section. So
pretty good guesses. So let's look at how to invest in your workforce. And remember what I said about moral injury. You know, burnout is, we understand it, but it's moral at a moral injury level now. So remember the question we just asked about turnover and investing in your workforce. Just keep that in mind. So what we have to do is focus on the system, focus on the environment and the circumstance, and not necessarily the clinician. Clinicians are working really hard to take care of the patients and to be a great team player. But one big issue is scheduling pressures. It's quite challenging when a clinician has, you know, multiple patients and several patients and EMRs. So alleviating scheduling pressures would make a huge difference in burnout and that moral injury. So remember, it's not just for new hires. It also affects, you know, some of our more seasoned clinicians, and it also affects recruiters, administrators, and support staff. It's an environmental issue. It's not just the clinician. Everyone feels the level of burnout because we're all in, you know, the same pool. We're all trying to help each other out to help patients, and everyone kind of feels that stress. So by being creative with scheduling, that can really alleviate pressures and burnout. So we've looked at, there's a shortage of clinicians, many are burned out. So how do we get new clinicians in? What about the recruitment end of it? So there's some significant challenges with that, as we know. So this is the question. The average hospital turns over 100.5% of its workforce. That's 100% turnover. That's astounding. The turnover rate is almost 4 times more for hospitals than medical groups, but more than half of medical practices say that staffing is their biggest challenge. You know, I gave you statistics about clinicians, but that's also for support staff. That's also for the MAs and for the administrators and other support staff that help run our facilities. Almost 100% turnover. So it's the 3rd worst after AI and financial services. As you know, talent shortage is the biggest problem. As you know, we understand that very well. we have needs, and then we have challenges finding talent. Also is that there's a increase in salary negotiations from their candidates. So, many clinicians are asking for not only that flexibility, less scheduling, but they also want increased compensation. Lastly, I spoke about moral injury, but job hunting is emotionally taxing. Almost half of job seekers, this is across all types of work, they say they felt lost and they lost a piece of their identity during the job hunt. So there are challenges, but there are also solutions. So with recruitment, it's really, this slide boils down to, it takes a long time and it's really expensive. For instance, it takes 260 days to fill a surgeon role. It can be up to $1.6 million in lost revenue per vacancy, 180 days to fill a family practice doctor position. Something that's really key on this particular graphic is that we have to be really intentional about who we hire and make sure that they're a good culture fit, beyond being qualified for the role, but being a great culture fit and being able to actually fit in for that long-term position that you may want that clinician to have. Because bad hires can result in a 32% drop in employee morale. So kind of that one bad apple can ruin the bunch. It also decreases productivity. So that's something to really keep in mind as you recruit positions. So we must invest in our staff. So not just the clinicians, but everyone is integral to how our organizations work. So one, we want to implement flexible scheduling. Remember that flexibility piece, and scheduling pressures add to the burnout for everyone. We have to build a sustainable supply chain. So, there are many efforts to increase the number of clinicians we have coming in. There's also efforts for other support staff to actually make sure that we have more of a robust pool. There's also something really important about the clinicians or staff that we do have, is that we train and we provide development opportunities. So while they're on the job, are there new things that we can offer to enhance not only the company, but their overall career development? We need support. So whether that's, extra MAs or extra administrative staff to actually help with some of the administrative burden, all the way up to, our APPs who are significant help and actually help, run many of our facilities. That's really critical. We have to use technology to make jobs more efficient. So I'll touch on technology in a little bit, but really taking a critical look at the needs and the gaps in the technology that would best fit your facility. Wellness programs, that can be anything from, a 5-minute meditation spot to, something more robust, but that's really important. We're looking at the whole person. Celebrate successes, no matter how big or small. It's important to do that and make sure they're recognized throughout your organization. Listen and understand your staff, new and tenured. Not only listen, but ask really intentional questions to better understand. So beyond listening, really being inquisitive about their needs and concerns for both the new and tenured. So even though turnover rates in the healthcare are really high, there's been many studies that very few hospitals and healthcare facilities actually have a formal retention strategy in place for retaining the more tenured workers that are there. So if you recall from the beginning, I spoke about the number of clinicians that are eligible to retire in just a few short years. But if there were actual retention strategies in place, that could really help in keeping our facilities well staffed. So approximately 60% of hospitals have strategies in place to protect new hires, but only 20% have a strategy in place for more tenured workers. So we really have to take a look at that. One great option is to consider slowing the exit of senior employees with kind of a phased retirement. That has been quite beneficial for many.
And we're going to do another poll right now. So you should see on your screen, does your organization have flexible staffing? Yes, no, or I'm not sure. And we will give 30 seconds for this poll. It looks like so far about 60% are saying yes. So that's the majority. And we'll go ahead and share the results. So we ended up with 62% saying yes, 15% saying no, and 24% saying I'm not sure.
Mm-hmm. That's great. It's great that 62% actually have that flexible scheduling. And, you know, I would be curious to know if that occurred after the pandemic or before and how it's evolved. But I'll go over a few flexible staffing solutions now. Some flexible hybrid solutions that, you know, we at locumtenants.com would recommend, and I have actually implemented, are on-site and virtual. APPs and MDs, that's either an NP or a PA in conjunction with an MD, you know, part of the time or together, full and part-time, and, you know, kind of a combination of all three. These are all really viable solutions that work. Something that's really important is going back to understanding your staff and understanding your culture and what you need in your facility, and seeing what works for everyone and how to best fulfill that need. So there are many benefits for flexible staffing. One, the ability to adapt to changes in supply and demand. So we know the supply may be low, but our demands are really high. It creates kind of a trickle-down effect when you have a mismatch with supply and demand. Morale goes down, productivity goes down. So having a flexible clinician model can maximize the pool of talent to pull from. You kind of have a bench or a pool that's ready to help with that supply and demand mismatch. Something else, your current employees actually feel valued, and managers feel empowered because they have that flexibility, because they know that there will be help when needed. And then it's just goes back to understanding your staff and understanding what your facility really needs. One thing we know is that when employees feel valued and managers feel empowered, overall productivity and the company overall does much better because of that. Lastly, there's more access to specialized skills, you get better results. So if you have, for instance, a specialty that's flexible that can come in, you can reduce your patient transfers because you have the availability and the ability to provide that care. You have decreased length of stay because you have staff to take care of them, and subsequently increased revenue. So these are all really important. Lastly, it helps because the staff doesn't feel so stretched thin. They're not as stressed, and it reduces medical errors. So that's always what we want, is to make sure we're doing the best to take care of our patients. So what about APPs, about our, you know, advanced practice providers, and how they actually help in partnership with MDs? This is, you know, just another flexible option as part of a hybrid on-site or remote solution. So for instance, if we have an APP on site with a physician, supporting physician that's on tele, that's a viable option. So when we asked again, in our survey at locumtenants.com with our clients, if they plan to expand advanced practitioner coverage this year, almost 72% said that they would. So the number of NPs and PAs have outpaced that of physicians by almost 70%. So these are practitioners who are actually added to the workforce between 2016 and 2030. Most of those will be APPs. And again, a really great flexible option is having on-site APPs and a telephysician. It's been quite beneficial. Another option is the telehealth expansion. It's not all one size fits all. It can be 100% remote. It could be hybrid on-site and virtual, full-time or part-time telehealth. It's great because it avoids patient transfers. So for instance, with teleneurology, you don't have to transfer a patient out of your facility to care for them if you have a teleneurologist available. When we asked that same client pool if they plan to expand telehealth in 2023, approximately 54% said yes. So when we also talk about expanding the work opportunities for virtual care through telehealth, 55% agree that opportunities to work more hours virtually via telehealth is quite viable. So what about telehealth for clinicians? When we ask clinicians what they really like about telehealth, the big thing is the ability to work from home and flexibility. And remember, one of the top dissatisfiers and the reasons why we're seeing exiting of clinicians early is because of lack of flexibility. So telehealth actually creates and provides the flexibility that's desired. Patients have really adopted telehealth. The vast majority actually really like telehealth. They're able to be seen by their physician or practitioner in their home. And many have already adopted telehealth and have seen a clinician within the last 12 months. So it's the way of the future. It's what's happening now, both for clinicians, patients, and medical facilities. So it's incredibly a great strategy to embrace kind of our gig mentality that we're talking about and the wave of the future. Another strategy is to leverage technology. So we're just talking about telehealth, but there are many ways to make technology work for you. Remember, I said you can just take a step back and look at, the gaps and the needs you have in your environment and decide what type of technology would be beneficial and see if there's something that would fit your facility to help. There are workforce planning platforms, there's credentialing technology. We just spoke about telehealth. A big thing is scheduling management software, EHR integrations. We know that clinicians also cite EMR stressors as being a top dissatisfier. And then just looking at AI-enabled technology. Are there ways that AI can assist your facility? The next strategy, go ahead.
We're going to do the last poll now, and this relates to this section. So what do you think the percentage of clinicians surveyed who are interested in local gig work? You can go ahead and type in your response. It's a specific number, not a range this time. And we will be sharing the real answer in the slides coming up. All right, so we had 18% say 27% of people were interested in local gig work. 13% 31% said 45% of people were interested in local gig work. 29% said 62% was the number of people interested, and 22% of the recruiters thought it was 73%. So we will see the right answer soon.
Yeah, that's right. So I just wanted to point out that most of the time when people think of locum tenens medicine and practitioners, it's that you travel and you're far, but there are opportunities and new types of employment everywhere. You know, it's shifted work for millions across the world, across the country, and physicians are actually taking a look at it and saying, this is a new way and a great opportunity. Technology has led to non-clinical and non-patient facing careers for many physicians. But what it boils down to, a lot of physicians are really committed to a high level of service, and they understand that they would really still, a lot of them would really still love to practice medicine. So we have to look at, you know, the outcomes such as quality, the method of delivery of care to the facility and the community, and expanding, you know, how we view how we staff our facilities, especially when there are urgent requests and urgent timeframes to help fill that. So here's what we get from the survey. 73% would be interested in working local, you know, kind of their community hospital or kind of within that region. 73% would be really interested in that. And 60% or 56% would be interested in traveling kind of out of their local area. So that says that you likely have, you know, a robust pool of clinicians that are right near your facility that would be interested in helping your locum tenens. So lastly, the strategy is implementing future-proof staffing models. So, you know, we've spoken quite a bit about, you know, other strategies for those specific things, but how do we create a future-proof staffing model that would be sustainable for whatever there is to come? So, you know, the gig economy is here. Clinicians are doing locum tenens medicine at increasing numbers. We're actually at locumtenens.com, we're seeing significant rise in number of clinicians of all stages, from just out of residency to retired who are returning, who are interested in doing locum tenens medicine as a gig. Overall, the demands that are placed on the workforce, it's really threatening our healthcare. We're unable to provide adequate coverage and care for our patients. Also, our support staff and the entire system is really strained and stressed. So by providing flexibility for the entire system, that'll help create a more robust system. Technology is evolving. Again, looking at the gaps you have and how technology can help and make sure it fits your facility. You know, AI is really helping. There's a study that showed that AI can actually assist in almost 2/3 of the jobs that we have. So to be able to find the right tool can really help. Using telehealth and optimizing APP are critical for future-proof staffing strategies. And locum tenens is a desirable work style for clinicians, and it's very important and part of our care. You know, we don't have to you don't have to reinvent the wheel. You know, there's resources and partners that can help create that future-proof staffing model. Are there any questions? Thank you very much.
Thank you so much, Dr. Esco. We did have a few questions come through on the Q&A. So if you have any questions, we have about 20 minutes to answer them right now. So feel free to add any questions as we're going through. The first one that was asked is from Rajesh, and he said, very few administrators consider the contribution of their leadership style and management strategy to provide burnout. how can we start to change this?
So with the management style was contributing to burnout, is that the question?
Yeah, so I think the question is basically like people's leadership styles within the organization, or maybe their management style is also contributing to burnout, maybe as much or equally so as just their overall workload.
Yeah. So there's something really important about leadership. Leadership isn't always top down. So in whatever role you're in, there are ways that you may be able to, if you've reached out to the administrator and the higher ups and there isn't a kind of a clear burnout plan in place, there are ways that, with your small cohort that you can actually help alleviate, internally some of the burnout by, being a leader yourself and saying, maybe there are opportunities where we can bring in staffing to help, or is there new technology, and coming up with those solutions and then, presenting it to your administration. I think they would really appreciate it. I think I found that most of the time that administrators, if they're presented with something that's viable and reasonable and, it's shown that this can really help the overall institution and ultimately the bottom line, I think there could be some reception to help alleviate burnout.
Thank you so much for that response. We had another question about giving an example of a strategy for retaining seasoned employees. And since we know fewer clinicians are entering the workforce and many are leaving, retention is top of mind for a lot of recruiters, and they're hoping for some kind of specific examples.
Yeah, so there are a number of things. One is, I'll talk about, first of all, those clinicians who are looking at retiring, kind of a phased retirement, and also bringing in additional help. So what that would look like is if a clinician is saying, hey, I want to retire, if you could speak with them and say, well, what if we get someone in to help 1 week a month or something like that and phase it out, then that can help with retention, and that soon to be retiring clinician would maybe wait. You can also enhance your AI systems, your technology, and also really listening and understanding to your staff to see what's important to them, what would make them stay, because every situation could be different. But again, the key is understanding your staff, leveraging technology, and looking at, those flexible staffing solutions, getting support and additional clinicians.
Thank you so much. We had another question about where and when is the physical workspace for our clinical teams? For example, will we see more physicians working from home or in telehealth office spaces?
Yes. So there will be an expansion of telehealth. There continues to be an expansion of telehealth. I'll give you an example. So many clinicians initially with the pandemic and telehealth thought that would be limited to, primary care specialties, but, surgeons see follow-ups via telehealth, and that space could be at home, it could be in an office, they could be half telehealth in the morning and actual clinic visits in the afternoon. The possibilities are limitless. There could be spaces, but typically at home, or it could be in the office, and it allows the clinician to have a better workflow with having that telehealth option.
Thank you so much for that overview. We had another question about, my state does not allow APPs to operate autonomously. Should I still focus on hiring APPs?
Absolutely. APPs, when I spoke about supporting your staff and creating flexible solutions, there's still going to be a need, and there is a need for support with APPs. In fact, I was just speaking about the PA compact, or the APP compact that they're trying to roll out, and it's just a matter of time before all of the states adopt it. it's become critical because APPs are now in many places able to practice at the very top of their license and to provide care that would not otherwise be available. Another reason why it's really important is because of those flexible solutions that I mentioned with partial telehealth, with the clinician being on telehealth and a APP, on site. So the trend is going that way. Even the statistic that I showed you that, 67% of all clinicians coming into the workforce are APP. So that is the trend.
That's a really great information. We had a question about when contract providers are coming on board, or locum tenens physicians are coming on board, that they require some hand-holding and that the onboarding process may be difficult or painful. And do you have any advice for simplifying that process or making it less painful?
I completely understand. We sympathize, we empathize. It's challenging, and onboarding and bringing new clinicians on, full-time or even contract is a challenge. But what's interesting is at locumtenens.com, we have the clinician deployment specialist, and it's kind of like a concierge service where basically from the very beginning of a clinician's assignment throughout and even at the end, we're there to support that process. So, we have deployment specialists that are able to assist. We work closely with the facility to ensure that we have all of the information and to alleviate the pressure as much as possible from our side for your facility.
I think that's the end of our questions. There was one comment that came in of saying that psychiatry is a huge specialty that has really embraced telehealth since the pandemic. And so we wanted to just point that out. Thanks for sharing that, Anonymous. And if there are any other questions, you can definitely be in contact with myself or the locum tenens team. And we are so happy that you joined us today. Thank you so much, Dr. Esco, for this amazing information. And again, we will be sharing the recording of this session and the presentation slides with you through the end of this week. And we hope you all have a wonderful rest of your day. Thanks so much.
Thank you. Thank you all for attending. Take care. Bye-bye.
Bye.